I'm George Leconte, CEO of New York City Health and Hospitals, Harlem. I migrated here from Haiti at the age of 10. We first lived in 104th and Broadway, went to Booker T. Washington Junior High, and very interesting school. Most people saw me as Frenchy. English wasn't very good, it was very poor. Had to quickly learn the language because as a non-English speaking person at that time, you were picked on quite a bit. And we had some interesting times. But I will tell you, it did make me a lot tougher. High school in Harlem, wonderful experience, truly a wonderful experience. Rice High School, 124th and Lenox, great memories there. Any high schooler, you can either have a great experience or you can have a poor experience. I actually had a great experience in high school. Made a lot of friends. Sports, which was one of the wonderful things. Rice versus Power Memorial basketball. I started my high school in the basketball. I made the junior varsity team. I thought I was the man in basketball. I thought I was going to be a professional player until we got to varsity. And reality kicked in, and it was like, no, 5'11" is not gonna get you anywhere, and there's a lot of people that can dribble and shoot a lot better than you. So transition to other things, track and field and other sports. But it was truly a wonderful experience. I'm a bit of a foodie. My family and I have enjoyed quite a number of places in Harlem. We could start off with Spoon Bread, Sylvia's, Red Rooster, Renaissance. I've gone to one of those quick pickup places is the Famous Fish, myself being a pescatarian. I'm a seafood person. The other place also is Devon's Fish and Chips. They make a really good fried okra. And to top it off, the wonderful Make My Cake. Oh yes, their red velvet, I assure you, my waistline certainly can show that. I've really been enjoying some great cooking in Harlem. The reason why I chose a career in healthcare is my mother, who's a registered nurse and also an asthmatic, inspired me into going to the healthcare field. Having seen her suffer quite a bit from asthma and having had to go admitted to the hospital a few times, it encouraged me to really go into fields such as respiratory therapy to really help people with respiratory diseases. I chose to work for the New York City Health and Hospital system because their vision matched my understanding in terms of providing care to the most vulnerable, to those who do not have access to proper health care. I believe in that. I believe everyone should have proper health care. My primary focus right now is really preparing us for Joint Commission, and in addition to that also, making sure that we get through this pandemic. At the same time, we are strategically planning on making sure that we build on what we've already started here at Harlem Hospital, so that we can make sure we provide care for our community for the next century or two. We really want to be the hospital for the Harlem community. We want to continue to provide the best care possible to our Harlem patients. The biggest lesson learned from COVID pandemic was teamwork. Teamwork. You know the old saying, teamwork makes the dream work. In this case, teamwork truly saved lives. It really gave us a bond as a team. Many of us became not just colleagues, we became friends. We truly became friends. People that for the rest of my life, I will still keep in contact with. And that really was the biggest lesson from, at least I learned in terms of administrative aspect, is, we're part of a family, this healthcare family. And we bonded together to take care of those patients that came in to seek help from us. My motto is, forward always, backwards never.